Module 4 is about management mindset. So nursing management is very involved and very complex. And in this program, we focus on ourselves, your mindset, and your impact on others. How well you manage yourself directly influences how well you manage others. And there's a good reason why and we know that old chestnut of air attendants telling you to put your air mask on before you help anyone else. It's because you can't help anyone else if you run out of air yourself. Managing self means being aware of yourself, your strengths, your weaknesses, how you're feeling and thinking, and how you're impacting on others. Your impact is largely a function of how you behave, which is heavily influenced by how you think. So the thing is that how we think of, the people in front of us, the situation we're in, a whole lot of factors in our lives determines exactly how we respond to them. And how we think is a very unique individual thing. There is a pattern to the way we think which is developed over many years through influence from our parents, from our friends, from our experiences, what was rewarded and what wasn't rewarded. And a tool that's really valuable in distilling our predominant thinking patterns is called It's Humans as Synergistics Lifestyles Inventory, or the LSI. So the LSI identified 12 styles of thinking that are either constructive, aggressive, defensive, or passive defensive. So the thing is, once you're aware of your predominant thinking pattern now, because this can change, and it's really important for you to know that, it will pick up how you're thinking at the moment. You get an opportunity to think about, well, how do I want to be perceived? What type of thinking or behaviour do I need to exhibit to motivate my team to operate in the way I want them to? Let's focus just on behaviour for a minute. How managers behave is generally determined, it basically determines their style. It's how they come across. The assumptions we make about the people we work with, or how we think about them, directly affects how we manage them and how we work with them. So McGregor has identified a theory of leadership motivation. And basically he said that managers have two different ways of thinking of their people. If they were thinking in accordance with theory X, they thought their people were essentially lazy, not that interested in working, would try and get out of work if they could. Their primary motivator wasn't work at all. And so if a manager thinks that, then they'll put in the way they'll behave will be to control and cajole their people, because their people, they're assuming, don't really want to be there, and they'll try and get out of work if they can. But a leader who espouses theory Y actually believes their people are here to make a difference, and that they, will do their best if they're given the chance, given the skills, the resources and the support. So they take a much more motivating, mentoring, facilitating approach. They'll think, well, hang on, what is it I can do to enable these people to do their best, because they want to do that. And that is an example of how we think and the assumptions that we make influence how we manage our people. The other influencing factor on how you come across as a manager and how you think is how your boss wants you to operate. I recently worked with first-line managers in a large IT firm in Melbourne. And the culture in that organisation was really defensive. It was both aggressive and passive defensive. And so was the style of the managers. They didn't want to behave like this, but it was really hard for them to do otherwise, to be countercultural. So if you're wanting to move the fulcrum up the lever so that you've got much more leverage, then you really need to be have an enabling and a trusting mindset that shapes your team into that lever that you need. You're really modelling the behaviour you expect, whether you know it or not. So everything you do tells your team what they should do. So for example, actively seeking feedback about your own performance and then responding in a constructive way to it will tell your people volumes. It tells them that no one's expected to be perfect, but personal continuous improvement is expected. I guess in summary, the approach that you take as a manager and as a leader to your roles has a very major impact on the culture of your unit. It tells your people how they should behave and what's expected of them. So this is a link between how you think, the assumptions you make, how you behave, and the culture that you have in your unit. And that influences the outcomes that you achieve. Some more examples. I want you to think, when you set goals in your team, do you involve your team in the process? Are your goals really clear and meaningful to them? Or are they not that appropriate or not that relevant? Are they fuzzy and unrealistic? When you manage performance, do you clarify at the start what's expected of your people, of your staff? Do you provide constructive and clear feedback on their performance and suggestions as to how they can improve? Or do you take over and try and fix their mistakes yourself? So in terms of managing change, do you have a culture that thrives on change? And that means you actually look at what's happening outside your unit. Do you take advantage of significant trends and new opportunities for your unit? Or do you dismiss the signals and the cues that indicate that actually you do need to adapt or change? Do you modify or change how things are done to improve your team's performance and productivity? Or do you reject ideas that they come up with as seeming too risky or too different, even if they could actually improve your team's performance? So in terms of communication, do you maintain open and direct lines of communication, or do you rely on the most convenient modes of communicating, things like email, for example, regardless of whether they're the most effective or appropriate? Managing learning, do you provide others with constructive feedback and suggestions to help them improve, or do you want to go in there and fix their mistakes and criticise them? In terms of results, do you pay attention to quality and quantity, or are you just paying attention to quantity? It's a bit tricky in health at the moment, isn't it? It's all about the targets. Do you check that the systems and the processes are effective, or are you focusing entirely on the results? Do you focus on what is achieved rather than how it was achieved? Do you focus on short-term or long-term effectiveness? For example, the impact of employee satisfaction and outcomes. All of these things, you get a choice, as to where you focus. And that has a big impact on how effective your team's performance, how effective your team is, and their level of performance.